It's really a pleasure to be here, and I will try to speak a little bit about my experience when it comes to medical aesthetics procedures, okay? I'm a consultant for Allergan, and I would like to talk something specifically of the patients that I seen here in Australia. I noticed that the girls that I had for a consultation, they were very good in their body style. And I know that people here in Australia, they are very outdoors. They love to enjoy life. And what is interesting is sometimes I look at them at a distance, and when I look at them closer, I have a perception that there is a little bit of discrepancy to what they look in their age here to what I see on their faces. What would be the other options to protect this? To be locked. So that means we won't experience the world. So this option is gone. Now, the question that I would like to ask you is this directly. I know you guys are very young here. Can I call you guys here and the girls is okay? Do you think you will age well? Who thinks you age well? Tell me. Who has no idea if you're going to age well or not? So there must be something that gives us the details. And I would like to say, no, you don't need to go to a crystal ball to know it. But I don't know here in Australia, but I know in Brazil, since I was a kid, they say, okay, if you want to know how your wife will age, take a look at the mother. Is the same here or you know? So there's this myth, real or no, but there is a genetic correspondence. I would like to introduce this daughter. She's 27 years old, and her mother when she was 18. Take a look. You see, yeah, when I look, it's more or less the facial shape, because this is the scientific photo with the hairbands, okay? And then what happens? This is the mother, 18, and this is the mother, how I met her, 55. I would like you to concentrate your eyes with the passing of the time. And when I look at the mother, I talked to her, and it was very interesting. She was very sports-oriented, but all of a sudden, she did not have the opportunity to take care of her face, right? Because in the last century, who was born in the last century like me? Who was born in this century? Who doesn't know when you were born? So I think I saw something here that I would like to discuss something about aging. Aging means to deflate. When we're younger, we have volume on our face. We have a skin that has moisturizer, natural, and all of a sudden, we lose volume. Our skin changes the quality, it becomes dry, and all of these changes is something that doesn't happen in one day. We don't go to bed looking old and wake up on the following morning looking old. It's a process. Now, what is interesting is this, we are combating aging already at home. You know how? With the hair. You know, everybody, sooner or later, they are bothered by these white hairs in the face, and they do some touch-ups. And something that I see is this, with the teeth, we learned since ever to take care of our teeth. And why is that? Our fathers and mothers, they have these habits that they learned already with their grand, whatever. That means we are aware. And once we are aware about something, we introduce in our daily activity, and then it becomes mainstream, sorry. Now, what do you see when you look in the mirror? I've noticed, and I've interviewed a lot of patients all around the world, and it's interesting that there comes that moment when they raise their kids, and also when they are working a lot. You know that moment then when you yourself in your bathroom looking and analyzing it? Sometimes in this moment, you start seeing something that you don't like anymore. And what I want to tell you, and that's why I started with, if we could objectively assess your future when it comes to aging, how well or positively you're going to age, would you act being aware of this? And the answer is this is what BeautyDecoded means. Today, believe it or not, my friends, we can know beforehand what happened in your future. What I wanted to contrast about the 20th century is that the most important driver for medical aesthetic at that time was lines. And to tell you the truth, you know, there are many procedures that we can improve our skin quality. We can do lasers, machines, chemical peels, injectables, threads, surgery. You know, the amount of things that we can have today to look better is incredible. What you don't know is the possibilities. That's why it's always very important to be slightly aware if this is something that would resonate with you. But from my perspective, believe it or not, I often ask, and I would like to ask you, is the presence of lines so bad in your face? Are you bothered about lines on your face? Raise your hands. What I find positively, like this, I see that she had a cosmetic treatment. You see, she has less lines. Of course that this is better than this. Do you agree? Yes or no? She looks like this fresher. Let's put in this. But in my perspective, believe it or not, I think this lady, she looks beautiful despite of the lines. Do you agree with me? Yep. So then I realized something very important that I'm completely against, which is the tyranny of beauty. Do you understand? So that means, why should everybody be flawless with no lines? Or everybody, when they are young, they have to have big lips? Or everybody has to have that nose? For me, no. This is so dated. This is so last century. No, it's true. It's true. Like this, so this trend is something that was so celebrity-oriented, Hollywood, you know, don't sense. So not now anymore. Life has changed. So I look at her. I like what I see. So I try to work as an external thermometer for my patients. Sometimes they come here, or young girls, they say, Mauricio, I hate this, I don't like this. I say, it's okay. No, it's okay. It's not good. But you know, this eyebrow is a little bit higher than this. Say, but this difference does not decrease your overall rating. Oh, I don't like my nose, it's big. Say, it works in your face. You say, it works. It brings harmony. So what clicked? And this is something that currently, most of the advanced injectors that we have, and also practitioners that does chemical peels, threads, surgery, the good ones, they are aware of it. Do you understand? This is very, very important. I would like to ask you something. Are we going to present for you 4 details, and I would like to listen from you to understand who I'm talking to. How about your dreams when it comes to your appearance? Who here would like to look more attractive? Who here would like to look youthful? Who here would love to have a better contour on their face? And who here would like to look more feminine for the girls and more masculine for the guys? What I call this? Common sense. Do you understand? This is what I call the dreams. If you ask anybody all around the world, these 4 adjectives, they would like, depend on the age group, of course. If I am in my 20s, so looking young doesn't fit in. However, attractiveness, it seems that it fits well everywhere, and contour as well. But now, I always ask my patients like this, what is reality? So this is something that ended up by creating. So, okay. Mauricio, I understood. Lines are not important. Having a big nose, small nose, big, it doesn't matter. Okay, what works is the harmony. But when I look at myself, why have I not reached the best version of me? Sometimes it's because I look tired. Sometimes I look in the morning when we wake up, right? Sometimes I look sad. I look angry, or somebody that is not approachable, or I look saggy. Question to you now. Who thinks of all these 4 realities, which one is worse? Who thinks is tiredness? Raise your... Who thinks is sadness? Who thinks is angry? And who thinks is saggy? Can I test with you? Can I test? Yeah. You told me sad, correct? Okay, look. Imagine we are friends. I come to Australia every year and I look at you. Yeah. Every year. We're friends. I say, hi, how are you? You look tired. So, you know, Mauricio, I'm very transparent, right? Like she's Italian, I'm Brazilian, so you're very direct. And then you answer me, Mauricio, you know what? I didn't sleep well last night. That's why I'm tired. Oh, good for you. Hi, you look sad. Pay attention. So Mauricio, you know, I have a family member that is sick. I'm not really well. Hi, how are you? Long time no see. You look angry. Oh, you know what? I was coming here to see you and have dinner, blah, 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 and I had a car crash, and oh, I'm really irritated. Say, hi, long time no see. You look saggy. Okay. Did I answer? Raise your hands. Now, why this is so important? Because when Erin was presented, and then she said, okay, so we need to receive information so that regardless what I present in my face, there must be a priority to start. Do you understand? I have a lot of details to fix, but there's something that I have to look for. And I tell you, my friends, Singh is the one. Do you understand? Now, we have the dreams and we have the realities, and how we bridge them is during the consultation. So it's only during the consultation where I have opportunity to take that moment for myself. And again, I love the presentation because in the moment, we have to connect with ourselves. And besides everything that have in family, work, whatever, we have opportunity to see, this is my time. This is the time that I'm going to look at myself. This is the time that I'm going to take action. And what is interesting is this. I present to my patients, interestingly, I'm going to show how I work, these emotional attributes. And I try to understand from the patient's perspective, what is in their mind? And what do they want to achieve by visiting me during the consultation? If you ever consider to do a consultation, take time to only get these 3 details. Which areas you would like to treat, and also which are the objectives from the message that you want to convey to people. So based on this, I would like to start with you and explain that the most important thing for us is to reduce the unfavorable messages of the face. And then we ended up by reviewing our best version. And this we do with the MD codes, which is the technique that I travel all around the world communicating and sharing with people. I love also your example about the house. You know, I love this because, you know, I try to make people understand that their faces is like the house. If I want to have a nice house, not confused, and you know something, maybe you don't take care of your house, but you take care of your house. I can tell. I always tell people that the first house we live in is our body. This is our first house, do you understand? So this is something interesting that the more areas that we want to see is just like, say, if I want to renovate the kitchen, if I want to the living room, it requires more sessions. And the concept that we have to clean the house first is the most important thing. Before I think about the dreams, that is, looking youthful, looking attractive, I have to fix what's wrong in my face. So take a look at this patient that I treated in one of the countries. I look at her immediately, and she looks tired. Do you agree? Yes or no? She looks low energy. Then, through a cosmetic treatment, take a look how she looks immediately after. That means that she presents lines here. She continues having the dark circles. However, what we notice is that her face looks more favorable. Do you agree? Raise your hands if you can see it. Okay, now, take a look when she smiles. Not only she looks better, but her smile is natural. You agree with me? It's very important in cosmetic procedures to look good when you don't move your face and when you're expressing. Another important thing is, she was so happy that the following day she sent me a photo and also a video. Take a look, saying she was able to return immediately to their social activity. This was the biggest difference that we have today, what we had with surgery. You know, surgery would be like this, trauma, and then it takes some period of time to recover. So the era that we have now, as you said, Stefania, this selfie generation, everybody wants everything for today. I would say even yesterday. You know, you guys are trained to do this. You click, you have information, you have everything. So I think the question of surgery is like this. You have today the procedure, and you have to wait until you recover. Is going to become less and less frequent. So I talked about something very important for you, that is, I am not bothered about lines, that I have to deepen a little bit. It depends. In this case, they are excessive. Do you agree with me? So it seems that, okay, it's okay to have lines, but I cannot have too many. You understand the point? It's okay to have a little bit shadow here, but not too expressive. So that means the degree of problems counts. What we used to do to cover the things that we don't like, we have an everyday ritual. That means wearing makeup and trying to use concealers to hide the tired look. Who does this here in the audience? Tell me. When I ask this everywhere, there is look, I would say, Aaron, there's almost no human being, except for men, but even some men, they hide, that they wouldn't take this as an alternative. If you are a little bit more mature, you will see that makeup sometimes cannot hide everything, and it won't. And then we have other alternatives, right? So we can hide them with big glasses and whatever. What I question to you is, take a look here. This patient that I also treated in another country, she had a small chin. And the question is, can I make something